Hi everyone, this is Dr. Suter. I think I'm live here, so I just wanted to say hi to everyone. I hope you guys can hear me. Um, I just want to make sure I can, share the link real quick with a few people. Let me see how to do that. There's always some technical thing, and Facebook managed to change everything. From the classical view to a new view, and it just, kind of sucks. So I'm having a little hard time here today. So give me just a second to kind of figure things out here. At least my camera is working today, so that's good. Never know about that. Always something. Always something. All right, I just wanted to share it with one of my groups here from the people at Holistic Animal Advice and Raw Feeding, Theo Pet Grocery. Just wanted to share it with my people over there so that they can see. Spaying. All right, almost done. Thanks for hanging in there. All right, let's post this. Hope it's working. I don't know. Well, we'll see. If not, I'll post it later. Okay, now going back to the live. Here we go. All right. Well, it's so good to see you guys all. So I see people are trickling in. That's wonderful. So let me just give you a little bit of an intro on myself for those who don't know me. I'm Dr. Odette Suter. I'm a licensed holistic veterinarian, and I focus on holistic health care. And you can learn all about me and my practice and what I do on my Facebook page that you're on right now, and also on peakanimalhealthcenter.com. And I did put a couple of links in the first comment about different things that I have to offer for educational purposes, because that's one of my passions, is to educate people and, spread the good information. I do have a book that you can purchase on Amazon. I also have a video series that involves a lot of different videos on basically everything you need to know to keep your animals healthy, including nutrition, GI tract, nervous system, vaccines. I mean, all the different things, everything you'd want to know. It's kind of like a little basic education that everybody really should have in order to, keep their animals healthy, and if they have issues, help them return back to health. I also have a newsletter, so feel free to sign up. The link is in the first comment as well, where I, send you guys some good information. And I will also have a cheat sheet of today's Facebook Live that I will send out through my newsletter. So if you'd like to get the cheat sheet, just click on the sign up link in the first comment, and you'll get it. All right, so I want to start with a little bit of, talking about the subject of spaying and neutering, and then I'm going to open up the floor to all of your questions. I've already received some questions from some people, so thank you for those. I will definitely get to some of them, and we'll talk about that. And yes, good morning, everybody. I'm so happy that you guys are all here, and it looks like you guys can all hear me. That is awesome. Hi to some of my people that I know, and a lot of new people, and people I don't know personally yet. But it's so good to see you guys all. All right. So when we talk about spaying and neutering, the first thing that always comes up is, of course, population control. So I just want to briefly mention here that this video is for responsible pet owners who have control over their animals, who don't let their animals roam around freely when they're in heat and or not neutered, as the case may be in dogs. So this is for responsible people who have control over their animals. If you're somebody who just lets your intact animal roam around freely, this is not for you. Though it may be for you if you want to become a responsible pet owner that way. Um, so I just want to, make sure about that, because I certainly do not subscribe to or encourage, the irresponsible breeding, because we do have a lot of shelters that end up killing animals because there's an over abundance, of animals that unfortunately can't find a home or have major issues, as a result of poor breeding and poor bringing up, etc. So this is really for people who are, taking really good care of their animals and are responsible. And I know most of you guys are, because otherwise you wouldn't really be here. But I just wanted to make it clear, because videos get promoted, they get shared, and I want to make sure that this is not misunderstood. I'm not promoting wildly breeding animals, because they all need a good home and they deserve a good home. And I don't, it just kills me to have to put animals down that are, not that are really still healthy, but just because they can't find a home. So this is not what this is about. And there has been a lot of research done, retrospective research on spaying and neutering in the last few, couple decades or so. And I want to talk a little bit about that research, because it's important to know some of the things and some of the diseases that are related to spaying and neutering, because we all want to prevent our animals from getting sick and having things that happen because we spayed and neutered them. And oftentimes I get people say, oh, I wish I had known, I wish it hadn't been done. And it's also about educating, because there are unfortunately still a lot of breeders out there that have their puppies spayed and neutered before they even leave their facility. And that really breaks my heart, because these animals don't ever even get to go through puberty. And they're already set up with a really poor quality of, potentially poor quality of life, because of the things that can happen, based on spaying and neutering. But basically, research has found that it shortens their lifespan. In some studies, they have found a reduction in health span by about 30%. And that's a lot, when you look at an animal that could potentially be 15 years of age or reach that, and will only live up to 10 years. So that's about 30%. So that's a huge amount, that's a lot of years that you could be missing out with your pets. Cardiac hemangiosarcoma is also 5 times more likely in spayed females and 1.6 times more likely in neutered male dogs. Bone cancers are up to 3.8 times higher. Prostate cancer is also much higher in dogs that have been neutered in male dogs. There is a thing called prostate hyperplasia, which is basically in intact male dogs where the prostate just enlarges, but it's benign. So it's not something that needs to be removed or can kill them. But it can cause issues with urination, for example, where the prostate just gets big and then pushes on the urethra, and then they can't urinate properly. And in those cases, if we neuter the animal, that decreases and the problem is solved. But prostate cancer is much more likely in dogs that have been neutered. And looking at the male dogs again, there's also always the fear that they will have more testicular cancer, and especially in dogs that have undescended testicles where they're retained in the abdominal cavity. There's also a bit of a higher risk of tumors, but the risk is never as high as they make it out to be. Only about 13% of dogs with retained testicles will develop tumors. And these tumors are very slow growing and mostly benign, and they can easily be removed. And, especially if you monitor, the dog regularly with ultrasound, for example, that can really help prevent them from becoming really huge and just removing them. And then, mostly again, they're benign. But other things that can also be affected, transitional cell carcinoma, which is a bladder cancer, is increased in neutered and spayed animals. Lymphosarcoma, hemangiosarcoma, mast cell tumors. There's also a higher risk for those. Abnormal bone growth and development, which then can cause more issues with cruciate ligament tears because the bone plates, they close at a certain time. And when we neuter an animal, when we remove the hormones, the growth plates don't close at the right time, so the bones continue to grow. And so if we neuter them, for example, between the growth plate closing of the femur, which is the thigh bone, and the tibia and the fibula, which is the lower leg bones, if we kind of neuter right in between those two closures, then one will just continue to to grow while the other already closed, which then can cause an abnormal angle within the joint of the stifle joint, the knee joint, and can make them much more prone to having cruciate ligament tears. So there are a lot of abnormalities that way. Elbow dysplasia can be another one as well. Patellar luxation, they're more prone to that, and that's especially an issue in smaller breeds. So we definitely want them to be able to grow properly. Hip dysplasia is also much more common, and other kinds of joint disorders. Obviously, urinary tract incontinence and bladder infection is also a higher risk when they're spayed and neutered, more so in the spayed animals, the females, because the urethra closure, the sphincter, is estrogen responsive. And if we remove all the estrogen from the body, then the sphincter doesn't close as well. And that can make them more prone to urinary tract infections as well, because bacteria can kind of move back in, aside from urinary incontinence. Hypothyroidism also increase. I remember I had one patient who was spayed, and then she ballooned up. I mean, when I first met her, she weighed more than more than double what she should weigh. So she was supposed to weigh about 25 pounds. When I met her, she weighed 60 pounds, and she was about a year and a half old. And that had, the ballooning up from the weight had actually started after she was spayed, sorry. Yeah, we use spaying for females and neutering for males. So if I misspeak, just don't worry about it. Just basically removing the sex organs. So anyways, there are a lot of things that can happen within the body when we remove all the sex hormones, because they're all connected to the other hormonal glands as well, including the thyroid, including the adrenal glands, and also then the feedback to the brain and the hormonal glands within the brain, such as the pituitary and hypothalamus, will also be affected from that. And that can cause all sorts of metabolic issues, including Cushing's disease down the road, atypical Cushing's, where we have too much of the hormones being produced by the adrenal glands, as a response of or as a disruption of the whole endocrine system. Hypothyroidism, I mentioned, diabetes that can't be controlled properly. So there are all kinds of different metabolic issues that can also result from that. Infectious diseases will also be more predominant because the sex hormones also have a huge influence on the immune system. And so, there's less white blood cells, etc. So they're much more prone to infections. Along the same lines, they're also much more reactive to vaccines. So they're much more likely to actually having a vaccine adverse reaction if they're spayed and neutered. up to 27 to 38% are the numbers that I found. Behavioral problems are also much more prevalent, such as noise phobia, fear behavior, aggression, ADD-like type of things. A lot of dogs actually, become worse because they have a decrease in hormones, and sometimes, supplementing with hormones can help with their fears. I just read a story from a dog who had low testosterone levels, and when they started supplementing with a little bit of testosterone, the dog went from being completely afraid of thunder and fireworks and all of that to basically say, yeah, well, whatever, whereas before they had tried to desensitize the dog and it didn't work. So just restoring the hormone levels really helped that dog feel much better and not have all these fears. Um, Weight gain obviously is a very common one in cats as well. I don't want to ignore those, although with cats we don't have a lot of studies, retrospective studies. It seems like they're not quite as affected by removing their hormones as dogs, for example, are, but they can also become more obese. They can have more weight gain going on as well, but they don't seem to have as much of the other things going on. So anyway, so that's a little bit of a brief intro. And I know there are a lot of questions, obviously, how do we prevent it? How do we do that? How do we, what can we do? So there are new procedures. Well, they're not that new, but they're kind of being introduced into the veterinary world. So for example, for females, we have the option of doing tubal ligation, just like in women. But we also have the option of only removing the uterus, which we call ovary sparing spay. So the ovaries are spared and we only take out the uterus. That has the benefit that, the animal, the female dog, will not ever have pyometra, because that is a little bit of a risk when they have hormones, the females, and they never get pregnant. Because what happens is during the heat cycle, there's, they ovulate. And then after that, there's more progesterone being secreted from the luteal body, from the yellow body. And then the progesterone itself helps to build up the uterine lining to prepare for implantation of the embryo if the female was impregnated. And that continues to grow. And then with a normal female who was pregnant, that uterine lining would be secreted out with, the birth of the puppies and kittens. But that doesn't happen if the animal does not get, impregnated and doesn't, give birth. And so the uterine lining will just continue to grow and grow and grow with each successive heat, basically. And what happens is during the cycle, during heat, the cervix is more open, so bacteria can go in through the cervix into the uterus. And because there's a lot of uterine lining and the immune system is also a little bit reduced at that time, because when sperm comes in, we don't want the sperm to be destroyed by white blood cells or by the immune system in general. And so the immune response is a little bit lower. So these bacteria can kind of take a hold and start to proliferate in there. And then eventually it can turn into a bit of a pussy mess, which we call pyometra. Pyo means pus, and metra means the uterus. So we end up with we can end up with a pyometra. And about 20% of female dogs that are intact and don't regularly breed will develop pyometra. And pyometra can become a life-threatening condition, especially if it's a closed pyometra, meaning that the cervix is closed, so the pus builds up in that uterus and swells. The uterus swells, and then it can rupture into the abdominal cavity, which, in most of the cases, the animals will die. With an open pyometra, the pus can, leak out, so it's not quite as life-threatening, but still obviously needs to be addressed. So those are kind of the risks a little bit that we have with female dogs, and that's why oftentimes, spay for females is recommended. But we can definitely just take out just the uterus and then leave the ovaries in so that they still have the ability to have their hormones. With male dogs, we have the option of just doing a vasectomy, which is only helpful if your male dog were to be around a lot of females and you want to let them roam around freely and have do their thing, and just not have your females get pregnant. That certainly would work for that if you want them to be able to experience some of the pleasures in life that they wouldn't be able to experience otherwise. And then sometimes it may also be an option if, for example, you have a breeder who requires that you sterilize your animal, meaning remove the ovaries or the testicles. So they may want you to do that. So then, if you have a contract to do that, then vasectomy is an option. But vasectomy, other than that, is really not that helpful. It doesn't change anything because the hormones are still there, so it wouldn't change anything else for your dog, for your male dog. So yeah, so vasectomy is only useful if if you have a contract for the most part. Otherwise, it's just a surgery. You have to put them under anesthesia. And every time we cut into something, we also create scar tissue. And scar tissue it can cause a constriction of some of the fascia. And the fascia is that little very thin little white lining that you sometimes see around meat. When you buy meat and you have like that little white little thin lining around the meat that's very tough. That's the fascia, and fascia basically surrounds everything. It surrounds nerves, muscles, internal organs, blood vessels, everything. And so if we have scar tissue, then that fascia will start to constrict a little bit, and then it pulls on all the other fascia in the entire body because all the fascia is connected. And that's why it's really important to do a lot of body work or regular body work after any type of surgery, not just neutering and spaying, to help release some of that scar tissue so that the body can move properly. Because again, constriction of fascia can down the line cause organ dysfunction. It also can make them more prone to injuries, especially cruciate ligament tears as well, because they just don't move the way they're supposed to move. All right, let me see, what else was I going to talk? Oh yeah, cats, Brigitte. But cats are constantly in heat if they're not spayed. That's not healthy, right? Yes, it's probably not healthy for whoever is around the cat, because when they're constantly being obnoxiously in heat, and they will make your life miserable, especially in the middle of the night, and especially if there are male cats roaming around outside that are not that are still intact. There's going to be a little bit of a howling contest going on all night, so that can be a little bit difficult. And cats can also develop pyometra, so definitely an issue with them. And for cats, we also have the problem that if they were to develop mammary tumors, which are usually more estrogen or hormone driven, 90% of the mammary tumors of cats are actually malignant. So it definitely would shorten their lifespan significantly. Whereas in dogs, only about 50% of the tumors are malignant. And if we catch them early, they can be removed. So it's less of an issue. But yes, they can be constantly in heat because cats, they ovulate when they get with intercourse, basically. So if they don't ovulate, then they will be consistently in heat because estrogen is still being produced. So that is a problem with female cats. they can cycle. I mean, they will go out of heat for a little bit, but then they come right back. So it can go on for, quite some time, and it can be very, very annoying for, whoever has to live with a cat, as well as the cat itself, because it's a bit miserable when you're constantly, having some sexual needs, feelings, and they're not being met. So that can be an issue with cats. Yeah, so spaying is definitely, can be very helpful for that. All right. Then I also had some other questions about, what to do when your animal was spayed or neutered. How can you help? Because now we have the hormones that are gone. We have disrupted their whole hormonal system. So what do we do now? How can we help them? So obviously, if there are some major issues going on, it's always recommended to do some testing. So University of Tennessee, they do hormonal testing, so we can do some testing, to see what the hormonal imbalance is, and we can help them out, to kind of, manipulate the hormones a little bit so that they can have a little bit of a better hormonal balance. So that's one way, to check. For example, if a cat or a dog, I should say, comes to me, cats don't really have a lot of urinary incontinence that way that I'm aware of. But dogs, when they have urinary incontinence, I always start out with body work, usually with chiropractic work, because that can help a lot, to help restore the nervous system and innervation to the bladder, and also the sphincters of the urethra, to make sure that they're really tight so that there's not constant leakage going on. So that helps a lot. In many cases, that's even enough. Just some regular body work to maintain them. Sometimes it takes one or two treatments and they're all continent again. But then there are also other animals that are a little bit more difficult. So definitely doing a little bit of hormone replacement, we can do that. There are natural ways of doing that with glandulars. For example, Standard Process has a glandular called Simplex F for female and Simplex M for males. So that can help. Dr. Becker, in her line of products at Mercola.com, she also has the glandulars for the males and the females. So those can help to just support them. Obviously, when there are more issues, then we want to do some testing and then be a bit more specific. But let's say your animal has responded okay and you don't have any particular issues after spaying or neutering, it can be helpful to feed them some of these glandulars, to help support them. There's also testicular tissue that you can get, and I think it was either My Pet Carnivore or Hair Today, one of those has actual testicles that they sell. So you could also add a little bit of testicular tissue to your animal's meal. Obviously, small amounts, not because I think the testicles are from sheep, so they're pretty big. So you'd only give a little bit here and there, just to help them, and then just see how your animal is doing with that. We can also do acupuncture, and Chinese herbs can also be very helpful. Chinese herbs would be based on their actual pattern, their Chinese pattern. So that would be very individual for each of these animals. We wouldn't want to just, randomly give Chinese herbs. And acupuncture can easily be done. You can also learn to do a little bit of acupressure yourself. You can have your veterinarian help you, show you which points to use. There's one right here in the head that can help to, stimulate a little bit of more, probably the pituitary gland and the hypothalamus, which are the, kind of top tier hormonal governing, glands. There's also one on top of the head, and then one um, down by the ankle, on the inside of the ankle, where the ankle. It's right. Yeah, it's right by. Actually, it's right above the ankle. There's like a little space where the skin is very thin, where you can basically touch, from both sides. Let me see if I can grab my foot. That might be easier. All right. Yeah, so it would be kind of right above the ankle right here. There's a tendon on this side, and then you have the ankle, and so right in there on the inside of it, that's kidney 3. So that could be very helpful for, helping to, stimulate a little bit, to help with the hormones. All right, so more questions. Are more and more holistic vets becoming versed in ovary sparing, spay, and vasectomies? I know when I was looking a few years back, not many did it in the Chicago area. Yeah, that's still the case, but it's definitely becoming more common. You can, call around to see who's doing it, especially veterinarians who are doing more of the reproductive type of work. They certainly do ovary sparing spays. And ovary sparing spays are not that difficult to do, really. I mean, because the only difference is that we leave the ovaries in, but we take the whole uterus out. With ovary sparing spay, we also want to take the cervix out because otherwise they risk having a stump pyometra. Because usually with a regular ovarian hysterectomy, we take out, most of the uterus, but there's usually just a little stump left. But if we leave the ovaries in, that little stump can still produce, more cell layers and can become infected. So we definitely want to make sure that that's removed. So to make sure of that, we just remove the entire cervix. And that way there's absolutely no chance that they could get stump pyometra. So that's really the only difference, and it's not difficult. The only thing with that is that because the incision just has to be a little bit longer in order to be able to get to the cervix, and therefore we can't do laparoscopic space that way. Because that's the other option too. It's a little less invasive sort of option to do the surgery, but it can't be done, with if we want to do an ovary sparing spay, just because of the length of, surgical field that would be needed. How do we monitor for closed pyo in an unspayed female dog? Well, usually the pyometra will develop within the first, within about 2 months, after they had their heat. So you definitely want to monitor for lack of appetite, any sort of GI issues, lethargy, excessive drinking, excessive urination, because the bacteria in the in the uterus, they produce toxins that then affect the kidneys, and kidneys as a result are not able to retain fluids as well, so the dog is constantly thirsty. So that fever, just not feeling well, you would definitely want to make sure you have a look at that. Wallace, Barbara says, Wallace has been having a lot of anal gland issues and infections. Could this be due to neuter? Yes, it certainly could be, because neutering affects, the hormone levels, and the hormones affect the immune system, and so there's definitely a chance that they are more, prone to infections and prone to allergies and things like that. Anal gland issues oftentimes are an allergy or allergy related, that certainly would affect. It could be affected through neutering, especially if it didn't happen before neutering. That's great. They perform it in New Jersey. I'm glad to hear it. And then what was there were some other questions as well. Yeah, Annette, my 17-month-old Yorkie had pyometra and had to be spayed. I'm heartbroken as I had hoped for ovary sparing spay at 3 years. Yeah, I mean, even if they had pyometra, you can always ask them to leave the ovaries in, because there's really no good reason to remove the ovaries when they have pyometra. So that's definitely something, to consider. If you leave your animal intact, your female dog intact, you can certainly ask your vet to only remove the uterus should there be pyometra. But not every vet might be able to do that. And since pyometra becomes a little bit of an emergency, especially if it's already a little, progressed, you may not have the choice to look around and find a vet. But you could also be proactive and just look around and find a vet who would be able to perform that procedure for you in that way. All right. I don't see any more questions. Do you guys have any more questions? Let's see. Well, otherwise, I will just talk a little bit more about some of the research that I have found, because that's kind of, important to know. Yeah, with Pymitra, I actually just discovered a website that has a lot of good information on there. And there have been studies done, especially when it comes to Pymitra with open and closed Pymitra, where if it's detected early enough, then we can actually give some drugs to help decrease the level of progesterone, and then also help to relax the cervix so that it can actually then flow out. I thought that was really interesting. I hadn't heard of that before, but I don't think it's being used all that much. I do have to do a little bit more research on that, but it's certainly great because, if you don't have to do surgery and can help to maintain and possibly even prevent pyometra from happening by giving them something to help decrease the hormone levels, the progesterone levels after they were in heat, then we could prevent pyometra down the road, and we could leave more dogs, female dogs, intact. Because the thing is, with the ovary sparing spay, we don't really have a lot of information yet as far as how that would affect the animal later on in life, because the uterus and the ovaries, they communicate with each other. And so when they communicate with each other, there's a feedback that happens. So if we remove the uterus, then there's that communication that is missing. And so we don't really quite know yet what's going to happen, and how that will look, because ovary sparing spays are relatively recent, surgery that's being offered. And so it can, we don't really know what the side effects of that will be. I did read a study a while back about mice where they had they had three groups, one that was intact, one where they removed just the ovaries and the uterus, and then one where they removed the uterus only. And they did, with mice, what they often do is they do memory testing, because that kind of helps them determine certain things, yeah, it helps them just determine what the effects are of certain procedures. And so what they found is that the mice who still had the ovaries but had the uterus removed had the worst memory of all. So removing both the ovaries and the uterus or leaving them intact entirely was better memory-wise than removing the uterus only. So we don't know enough yet. And these were mice, they're not dogs, so that may be a very different, different animal, but we don't know. But there's also, I was just talking to someone yesterday who had to have her uterus removed. She had a hysterectomy, and she basically went into menopause, even though she still had her hormones. So there is definitely a connection between the uterus and the ovaries, and there are hormonal, connections with that. So removing the uterus can still cause issues down the road. So we just don't know enough yet. But one thing that people tend to be a bit surprised when we say that we remove the uterus, that the dog can still go into heat. So they look at me a little surprised because they think that, well, how's that, possible? But because the hormones are still there, they will still cycle normally. So their vulva will get bigger. They can still have false pregnancies, where they start to produce milk and start to, herd their little, toys and start nesting and be a little weird. So they can still have all of that because the hormones are still there, but they won't be bleeding. Though I have one dog where we did a ovary sparing spay on, and she was still having a little bit of discharge, because there's still a little bit discharge that also comes from the vaginal tissue. So they can still have a little bit of discharge from that. So definitely, you know, something to be aware of, and they will still be attractive to male dogs, which you'd have to be careful because since we remove the cervix, they really can't have intercourse with any male dog, so they're not, you know, they're not considered, you know, to be sexually protected. So they could actually end up with damage, you know, if the penis actually enters and then, you know, because the vagina is a little bit shortened, so if the penis then is too long, there could be some physical damage that happens with intercourse. So we definitely want to be careful about that and make sure that the animals don't, you know, get damaged that way. All right, so my little dog recently had an emergency spay for pyometra. What treatments should she have? That you were alluding to that sounded like physical therapy or massage or something. She often walks kind of stiffly, and now I'm wondering if it could be the surgery or that she's 11 and a half years old. Well, it could be both, but anytime they're on a table doing surgery, the legs are attached, you know, to the table to kind of be pulled away to create the, you know, to open up the surgical field. And if the legs are pulled back too far, what happens is it hyperextends the lumbar area, the back, and that can cause some nerve damage in that area, which then also can make them more prone to, well, not being able to move as well because there's pain, but also make them more prone to urinary incontinence. So what I like to do is I like to do chiropractic work. That's one of my main things. But I also like to do visceral manipulation, and that's something that I learned from from the human field, where it's basically kind of helping to release that scar tissue. That kind of therapy cannot be done right away. You have to wait for the scar tissue and for everything to have healed properly in there before we start to kind of loosen things up. But definitely, you know, having her checked out chiropractically, that would be awesome. That should really be done for any dog, whether they have had surgery or not. That's a very important thing just to keep them maintained, you know, in their lives and you know, feeling well. Can I still help my girl who was spayed at 4 years old by adding hormone supplements now after so many years? Definitely. It's still very helpful to support their body with a little bit of hormonal support. And I mentioned, you know, standard process has some glandulars. Dr. Mercola sells the Dr. Becker's line of glandulars. So, you know, just feeding those can certainly help because the thing is that the body, when we remove the sex organs, um, it has to compensate. And some of the other glands will start to take over. So for example, for estrogen, the brain will make estrogen, the adrenal glands will make estrogen, and fat will also make estrogen. And so these areas of the body are not really meant to compensate completely. So they can get a little bit exhausted by that, especially the adrenal glands. And so supporting the adrenal glands can be very helpful with glandulars. We can do that as well, decreasing stress in general, feeding them a good diet, that sort of thing. That can all help to support the adrenal glands to then also make some of the hormones, including the precursors for these hormones, such as DHEA, for example. Because all the hormones, you know, the steroid hormones, they all have a connection because they all have the same precursor, and then depending on what's needed, it just kind of makes either cortisol or it makes testosterone, progesterone, estrogen. So depending on the need, these precursors will kind of go into a different direction biochemically, you know, where they're turned into the hormone that is needed. So if we can help with the precursors of these hormones, that can be, you know, helpful to then allow the body to do what it needs to do, and you know, allow it to, you know, make what it needs, basically. All right, my dog, when I got her home at from the rescue who was spayed at 6 weeks. Now she has hip dysplasia and some incontinence. When should I evaluate for hormone replacement? Now would be good. As soon as there are symptoms, and preferably even before there are symptoms, helping them. And then what symptoms should I look for to take her to the vet for further evaluation of hormone replacement? Well, anytime there are symptoms, like urinary incontinence can be one. Although again, in my experience, oftentimes it can be helped very easily with just some body work. Hip dysplasia obviously requires regular body work as well, because you want to maintain the strength of the muscles around the hip joint so that the hip joint is more stable, which then causes less arthritis down the road. So basically, anytime something has been removed or something isn't right, don't wait. Do something about it, right away. Prevention is worth a pound, an ounce of prevention is worth a pound of cure. So waiting is never a good choice, in my opinion. So I hope that helps. And again, for evaluation of hormone replacement, we can certainly work with doing some lab testing. This is very enlightening. I respect your knowledge and the time you're taking to educate us. Well, thank you very much, Valerie. I appreciate that. I know everybody's very grateful. All right, so it looks like I covered most of the questions. So unless there's anything else that will pop out in the next 2 seconds, I think we're gonna kind of get to the end of this. I really, really appreciate you guys all being here. It's such important information. And again, I encourage you to share this information because, the more people know about it, the better. Because there are a lot of really responsible pet owners out there, and I want them to know and be able to have a really healthy dog and not a dog with all sorts of issues down the road just because the hormones were removed. So please share. But thank you so much for everybody who joined today and for your great questions. And also remember to sign up for the newsletter. I pinned it in the first comment of this post so that you can get the cheat sheet and get some further emails on other things, other Facebook Lives. So anyways, enjoy your Sunday. It was great to see you guys all. I love you, and thanks for making a big difference in your own animals' lives and also the lives of other animals by promoting and sharing and talking to your friends and families, etc., because you're the ones that educate and continue you're the ripple effect. So thank you so much. I love you all. Have a wonderful day. I'll see you soon.